Hi, Dr. Masa at Ace Chiropractic Clinic. Today's topic is hip pain. Causes of hip pain. There are some of the conditions that commonly cause hip pain, such as bursitis. Bursa are sac of the liquid found between tissues such as bone, muscles, and tendons. They ease the friction from these tissues rubbing together. When bursa get inflamed, they can cause pain. Inflammation of bursa is usually due to repetitive activities that overwork or irritate the hip joint. Tendinitis. Tendons are the thick bands of tissue that attach bone to muscle. Tendinitis is inflammation or irritation of the tendons. It's usually caused by repetitive stress from overuse. Muscle or tendon strains. Repeated activities can put strain on the muscles, tendons, and ligaments that support the hips. When they become inflamed due to overuse, they can cause pain and prevent the hip from working normally. Arthritis. Osteoarthritis and rheumatoid arthritis are among the most common cause of hip pain, especially in older adults. Arthritis leads to inflammation to the hip joint and the breakdown of the cartilage that cushions your hip bones. The pain gradually gets worse. People with arthritis also feel stiffness and have reduced range of motion in the hip. Hip fractures. With age, the bone can become weak and brittle. Weakened bones are more likely to break during a fall. Hip labral tear. This is a rip in the ring of cartilage that follows the outside rim of the socket of your hip joint. Along with cushioning your hip joint, your labrum acts like a rubber seal or gasket to help hold the ball at the top of your thigh bone securely within your hip socket. Athletes and people who perform repetitive twisting movement are at higher risk of developing this problem. Cancers. Tumors that start in the bone or that spread to the bone can cause pain in the hip as well as in other bones of the body. Avascular necrosis, also called Osteonecrosis. This condition happens when blood flow to the hip bone slows and the bone tissue dies. Although it can affect other bones, avascular necrosis most often happens in the hip. It can be caused by a hip fracture or dislocation or from the long-term use of high-dose steroids, among other causes. Subluxation. Subluxation is misaligned the spinal bone or any other bones and affect to the nerve system, interrupt nerve signals we chiropractors call subluxation, and those irritating signals from the nerve may cause of bone and muscles and ligament abnormalities and pains. So especially lumbar spines and pelvic sacroiliac joint may cause of the pain in the hip. Symptoms of hip pain, depending on the condition that causing your hip pain, you might feel the discomfort in your thigh, inside of the hip joint, growing outside of the hip joint, buttocks. Sometimes pain from other areas of the body, such as the back, pelvis, or groin, can radiate to the hip. You should have chiropractic doctor's examination if your pain doesn't go away. You notice swelling, redness, or warmth around hip joint. A fall or other injury triggers the hip pain. You heard a popping noise in the joint or maybe back when you injured it. Also, call your family doctor as a medical doctor right away if you have hip pain at the night or when you are resting. The hip pain comes on suddenly. The pain is intense. You can't move your leg or hip. Your joint looks deformed or is bleeding. You can't put any weight on your hip. You should call your medical doctors. Otherwise, chiropractors are primary healthcare providers, and if it's necessary, they will refer you to medical doctor. So you can see a doctor of chiropractic first. When the chiropractors examine the patient and find some reasons, chiropractors take x-rays. This is a typical lumbopelvic area x-ray image, and it includes hip joint. So this is within normal hip joint images. So the cartilages are well maintained and the bone shape looks normal. This image has dislocation of hip joint. This image, not only the hip joint but the femur bones, it's an osteosarcoma or Paget disease. So we have to refer to the medical doctor right away. This image also have a bone tumor on the femur bones here. So we have to send patient to the medical doctor to make sure it's a benign tumor. This image, patient have bilaterally degenerated hip joint. The cartilages are almost gone. So these conditions, we have to send the patient to the medical doctors and consider neither hip replacement or so. This image is spondylolisthesis, which means bone is separated and vertebral body is slipped to the front. So the nerve is pinched and pulled somewhere in this area. It may cause low back pain, or those pain radiate to the hip areas. So patient has hip pain. And also this area, we chiropractors cannot adjust from the back. So we have to do different ways. After taking history, how the pain occurred or happened, and what kind of symptom patient have, we start checking the patient. First, observe the hip joint area and compare and contrast how it looks, or heat, and where pain has. Then move like a telescoping and bend and twist and check the pains and also how it moves. And of course, compare. And if it's necessary, take x-rays. And if the cause of the hip pain is due to subluxated vertebrae on low back area or pelvic, we do chiropractic adjustment to solve the cause of the pain. First examination for the chiropractic is titled C5000, which is an infrared thermal scan. Today's results shows abnormal temperature on sacroiliac joint. It may cause of hip joint pain because she's a ballet dancer, so probably overuse, and it's affect to the sacroiliac joint subluxation. The next step is using nervoscope. Find where the subluxation occurred and make sure. Then we do static palpation. And motion palpation. Combines all of those data and findings like a Titan C5000 and Nervoscope and X-rays and also palpations. We chiropractors decide what vertebrae or pelvis or sacrum we have to adjust. The adjustment for lumbar area or pelvis, we use this pelvic bench. Patient lay down like this and support. Then finding a spot and contact and stabilize. Then gently adjust like this. It's a minimum force specific adjustment. It's safe for kid too. When the cause of the hip pain is not subluxated lumbar spine or pelvic, we have to do a different approach to reduce the pain or solve the conditions. This is electromuscular stimulator treatment for the muscle pains and spasms. This is the one option treatment, and also infrared heating, so the warm temperature improved blood circulations and also relax the muscles and improve the condition. This is another option, which is acupuncture treatment. The needle is put on the acupuncture point and stimulate the brain and let the brain create endorphin, which is 300 times stronger than morphine. It's a painkiller substances, but it works without any side effect. So those acupuncture help reduce the pain and also relax the muscles, improve the blood circulation, and infrared heater working together. When the patient is kid and afraid of needles, of course we have an option as an pediatric acupuncture needles, which is not really needles. We do not penetrate the skin. It just stimulate like this, and that make an endorphin and reduce the pains. Or using this kind of needles, which is also not penetrate the skin, just stimulate acupuncture point like this. This is not painful, maybe ticklish for some kid, but like this, and pain is reduced. And also Ashin Ryoki, this is also just touching the skin and effect as shiatsu and acupuncture together. So no pain, but works great. And the other option is muscle work. Relax the muscle by hand, fingers, shiatsu like a stimulation to the acupuncture point, and let the muscle relax. And also moving the joint like an exercise and relax the muscles and reduce the pain. Hip pain is caused by cancer, bone fracture, tumors, and arthritis and tendinitis, a lot of different causes. So we chiropractors take x-rays and make sure your bones and joint are okay. But if it's not, we will send to the medical doctor right away. So see a chiropractic doctor first. And at the ACE Chiropractic Clinic, we can adjust your spine if the subluxation is a cause of your hip joint pain. And if it's not by subluxation and other reasons, we offer acupuncture and other treatment options. Thank you for watching. Bye now.